सो इकोलॉजी ऑफ हेल्थ पढ़ने से पहले हम लोग देख लेते हैं कि इस चैप्टर से क्या क्या क्वेश्चंस आए हैं. दैट वुड बी मच बेटर, क्योंकि हमारा फिर एकदम ओरिएंटेशन में पढ़ाई होगा. सो या यस, तो हम लोग आगे देखते हैं कि इस चैप्टर से क्या क्या पढ़ाई हुआ है. राइट, एक we do it straight. It's visible, right? Yeah. One second. या कॉन्सेप्ट ऑफ हेल्थ एंड डिजीजेस से क्या क्या क्वेश्चंस आए हैं ये देख लेते हैं. 3 बार क्या पूछा है? डिफाइन हेल्थ एंड डिस्क्राइब वेरियस कंसेप्ट्स ऑफ हेल्थ. सो कंसेप्ट ऑफ हेल्थ में क्या आ जाएगा? दीज आर द स्पेक्ट्रम. ये डिटर्मिनेंट ऑफ हेल्थ है. हम लोग ने डिटर्मिनेंट ऑफ हेल्थ पढ़ लिया ना. कंसेप्ट ऑफ वेलबींग यहाँ पे दिया हुआ है. डिस्क्राइब वेरियस कंसेप्ट ऑफ हेल्थ एंड इट्स डिटर्मिनेंट्स. सो कंसेप्ट एंड डिटर्मिनेंट पूछ रहा है. डेफिनेशन ऑफ हेल्थ इज गिवन हियर ना. देयर आर 4 कंसेप्ट जो कि दिया हुआ है. पहले बायोमेडिकल कंसेप्ट, इकोलॉजिकल कंसेप्ट, साइको सोशल कंसेप्ट और होलिस्टिक कंसेप्ट. और फिर उसके बाद डेफिनेशन ऑफ हेल्थ इज गिवन. देन डायमेंशंस दिया हुआ है. व्हाट हैज़ बीन आस्क्ड? डिटर्मिनेंट्स बोल रहा है. डायमेंशंस नहीं पूछा है तो डायमेंशंस के बारे में नहीं बताना है. सो डेटर्मिनेंट्स ऑफ हेल्थ फिर पूछा है, तो डेटर्मिनेंट्स में हम लोग को बायोलॉजिकल डेटर्मिनेंट बताना, बिहेवियरल, सोशियो कल्चरल, इन्वामेंटल, then socio-economic condition, then health services, aging of the population, gender or other factors. These are the determinants of health. ठीक है, तो हेल्थ पूछा, हेल्थ का कॉन्सेप्ट पूछा जो 4 कॉन्सेप्ट होता है, और डेटर्मिनेंट पूछा जो 8 डेटर्मिनेंट होता है. ठीक है. देन उसके बाद ये क्वेश्चन 2 बार रिपीट हुआ है. क्या है? नेचुरल हिस्ट्री ऑफ डिजीज एंड इट्स एप्लीकेशन इन पब्लिक हेल्थ. नेचुरल हिस्ट्री ऑफ डिजीज़ है और उसका एप्लीकेशन क्या होता है पब्लिक हेल्थ में. ठीक है, ये आगे पढ़ेंगे तो पता चलेगा. देन हमसे पूछ रहे हैं, हमसे फिर पूछा है डिस्कस वेरियस लेवल्स ऑफ प्रिवेंशन विथ एग्जाम्पल. वेरियस लेवल्स ऑफ प्रिवेंशन पूछ रहा है. तो प्रिमोडियल, प्राइमरी, सेकेंडरी, टर्शरी, पता नहीं इस चैप्टर में दिया है कि नहीं, बट ठीक है. वेरियस मेजर्स पूछ रहे हैं. 2018 में 10 मार्क में आया था. 5 मार्क में क्या आया था? सो हेल्थ इंडिकेटर, एन्यूमरेट एंड एक्सप्लेन. हेल्थ इंडिकेटर क्या है अब ये देख लेते हैं. हेल्थ इंडिकेटर तो ये हो जाएगा ना, स्टैंडर्ड ऑफ लिविंग, लेवल ऑफ लिविंग, क्वालिटी ऑफ लिविंग, HDI, PQLI. हेल्थ इंडिकेटर्स एन्यूमरेट करना और एक्सप्लेन करना ना. उसके बाद द कंसेप्ट ऑफ पब्लिक हेल्थ. फिर आया है डॉक्टर पेशेंट रिलेशनशिप एसेंशियल्स ना. उसके बाद आया डेमोग्राफिक प्रोफाइल ऑफ इंडिया, डिस्कस ब्रीफली. डेमोग्राफिक प्रोफाइल आई डोंट थिंक इट्स फ्रॉम दिस चैप्टर. वो हमें वो देना है ना कि फेज 1 2 3 4 5 होता है. देन हेल्थ प्रमोशन एंड एजुकेशन का प्रिंसिपल. देन 2 मार्क में क्या है? डिफाइन प्रीमोडियल प्रिवेंशन, डिफाइन हेल्थ एजुकेशन, होलिस्टिक हेल्थ क्या होता है, ये सब डिफाइन करने को आया है. ओके, Hi, Shank. So you were discussing the questions that has came. So yeah, a lot of questions have came from this chapter itself. So let's read ahead, okay? That would be a good thing to do. अच्छा, रिजोल्यूशन आ रहा है कि नहीं आ रहा है? रिजोल्यूशन ओके? अब ठीक है कि नहीं? ओके देन दैट्स गुड. अब हम लोग आगे पढ़ते हैं. सो हम लोगों ने कुछ कुछ क्वेश्चंस देखे जो इस चैप्टर से आए हैं. इट्स लाइक डिटर्मिनेंट ऑफ हेल्थ पूछा है, तो 8 डिटर्मिनेंट हेल्थ का होता है, ये यहाँ पे दे रखा है. पहला इज बायोलॉजिकल डिटर्मिनेंट, देन बिहेवियरल सोशियो कल्चरल कंडीशंस, देन इन्वायरमेंट, then socio-economic condition, health service, aging of the population, gender and other factors. और फिर तुम्हारा पूछ रखा है कि व्हाट इज़ द डेफिनेशन ऑफ हेल्थ, जो कि WHO ने अच्छा खासा डेफिनेशन दे रखा है. तो बेसिकली आप ये याद कर सकते हो कि health is a state of complete physical, mental, social well-being and not merely an absence of disease or infirmity. ये आप याद कर सकते हो. देन उसके बाद कुछ कुछ क्वेश्चंस और पूछा. अब आगे बढ़ते. इकोलॉजी ऑफ हेल्थ हम लोग देख रहे थे. So ecology is a key word in present health philosophy. It comes from Greek oikos, meaning a house. ठीक है. हेलो शंक, आर यू लिसनिंग? सो ओइकोस मतलब होता है हाउस. सो ये जो टर्म है इसका मतलब होता है हाउस. सो कैन यू ब्रिंग लिट्टी फॉर मी? ठीक है, आगे पढ़ते. ओइकोस इज डिफाइंड एज द साइंस ऑफ म्यूचुअल रिलेशनशिप बिटवीन लिविंग ऑर्गेनिज्म एंड देयर इन्वायरमेंट. ठीक है. ह्यूमन इकोलॉजी इज अ सबसेट ऑफ मोर जनरल साइंस ऑफ इकोलॉजी. इज डिफाइंड एज द स्टडी ऑफ ह्यूमन groups as influenced by environmental factors including social and behavioral factors. A macro level holistic approach to the study of human organization. A full understanding of health requires that humanity be seen as part of the ecosystem. The human ecosystem includes, in addition to the natural environment, all the dimensions of the man-made environment, जैसे कि physical, chemical, biological, physiological. In short, our culture, all its products, and all its products. So, disease is embedded in the ecosystem of man. Health, according to the ecological concept, is visualized as a state of dynamic equilibrium between man and his environment. Now, by constantly altering his environment or ecosystem by such activities as urbanization अगर कर देंगे, industrialization कर देंगे, deforestation करेंगे, land reclamation, construction of irrigational canals, dams, man has created for himself new health problem. For example, the greatest threat to human health in India today is the ever increasing unplanned urbanization, growth of slum, deterioration of environment. As a result, disease at one time thought to be primarily rural have acquired serious urban dimension. The agent of a number of disease, for example dengue, chikungunya fever, which were effectively controlled, have shown a recrudescence. The reason for this must be sought in changes in the human ecology. Man's intrusion into ecological cycle of disease has resulted in zoonotic disease such as Kaya, Kayasanur forest disease, rabies, yellow fever, monkeypox, Lassa fever, etc. Now, the Bhopal gas tragedy 1984 highlights the danger of locating industries in urban area. The nuclear disaster in Soviet Russia in April 1986 is another grim reminder of environmental pollution. Now, construction of irrigation system and artificial lakes have created ecological niches favoring the breeding of mosquito and snail. In fact, ecological factors are at the root of the geographical distribution of disease. Therefore, it has been said that good public health is basically good ecology. Now, some have equated ecology with epidemiology. And the main distinction between epidemiology and ecology is that when epidemiology is the study of the relationship between uh, variation in man's environment and his state of health or disease. Ecology embraces the interrelationship of all the living things. In regard to epidemiology, constitutes a special application of human ecology or that part of ecology relating to the state of human health. Now, it is now being increasingly recognized that environmental factors and ecological considerations must be built into total planning process to prevent degradation of ecosystems. Now, prevention of disease through ecological or environmental manipulation or interventions is much safer, cheaper, and more effective uh, rational approach than all the other means of control. Now, it is thought that environmental manipulation, that disease such as cholera एंड अदर डायरियल डिजीज़ जैसे कि टाइफॉइड मलेरिया और अदर वेक्टर बॉर्न जो डिजीज़ होता है और हुकॉम डिजीज़ जो होता है कुड बी ब्रॉट अंडर कंट्रोल और एलिमिनेट किया जा सकता है द ग्रेटेस्ट इन्वॉल्वमेंट improvement in human health thus may be expected that from the understanding and modification of the factors that favor disease occurrence in the human ecosystem. Professor Rene Dubos believed that man's capacity to adapt himself to ecological changes is not unlimited. Man can adapt himself only in so far as the mechanism of adaptation are potentially present in his genetic code. ना राइट टू हेल्थ राइट टू हेल्थ क्या कहता है कि with the establishment of WHO for the first time, the right to health was recognized internationally. The WHO Constitution affirms that enjoyment of the highest attainable standard of health is one of the fundamental right of every oops, एक फंडामेंटल राइट है ऑफ एवरी ह्यूमन बींग विदाउट distinction of race, religion, political belief, economic and social condition. Now, over the time, this recognition was reiterated in a wide array of formulation in several international or and regional human rights. The International Convenient on Economic, Social and Cultural Right, widely considered as central instrument of protection of the right to human to health, recognizes the right to health of everyone to the enjoyment of the highest attainable standard of physical and mental health. Now, it is important to note that covenant give both physical health and mental health equal consideration. The steps to be taken to achieve full realization to the right to health includes those necessary for the provision for the reduction of stillbirth rate and infant mortality for the healthy development of the child. ठीक है, the improvement of all aspect of environmental and industrial hygiene, the prevention and treatment and control of epidemic, endemic, occupational and other diseases. मतलब occupational diseases हटाओ, environment और industry का hygiene बढ़ाओ, stillborn और infant mortality कम करो, and certain of conditions which would assure to all medical services and medical attention in the event of sickness. Now, uh, operationalize operationalize the above provision, the UN Committee of Economics, Social and Cultural Rights adopted General Committee on Right to Health in the year 2000 and set out that the right to health extends not only to timely and appropriate health care but also to the underlying determinants of health, such as access to safe and potable water, adequate sanitation, adequate supply of safe food, nutrition and housing, health, occupation, environmental condition, access to health related education and information, including those of sexual and reproductive health. According to general comment, the right to health also has a core content referring to the minimum essential level of the right, with above mentioned key element in addition to the supply of essential drugs. So, the human right to health care means that hospital, clinic, medicines, doctors' service must be accessible, available, and acceptable. Non discrimination, physical accessibility, affordability, and international accessibility. And a good quality for everyone on the equitable basis, where and when needed. The key principles are universality, equity, accountability, transparency, and participation. So, at the international level, the Universal Declaration of Human Rights, established in 1948, acknowledges the relationship between health and well being, and it's linked with other rights. The other international human rights treaty recognizes the right to health as follows: 1965 International Convention on Elimination of All Form of Racial Discrimination. 1966 में क्या है? इंटरनेशनल कॉन्वेंट ऑन इकोनॉमिक सोशल एंड कल्चरल राइट्स. Now what's here? 1979 में Convention on Elimination of All Form of Discrimination Against Women. 1989 में Convention on Right of Child. 1990 में इंटरनेशनल कन्वेंशन ऑन प्रोटेक्शन ऑफ द राइट ऑफ ऑल migrant workers and members of their families. 2006 में Convention on the Right of Person with Disabilities. So numerous conferences and declarations, such as Declaration of Alma Ata on primary health care, WHO designed plan Health for All by the year 2000, which consists of a series of goal and program to achieve minimum level of health for all. Later on, promoting health, one of the fundamental aspect of primary health care, has been addressed independently by four successive conferences: Ottawa, Canada; Jakarta, Indonesia; Cairo, and Conference of on Women in Beijing. So the United Nations Millennium Development Goals, Declaration of Commitment on HIV/AIDS, and more recently Sustainable Development Goal 2015, 2030 Agenda for Sustainable Development has health or the right to health care is recognized in at least 115 countries' constitution. So responsibility for health क्या होता है? क्या responsibility health के लिए है, ठीक है? तो ऐसा 4 responsibility है. क्या है हम लोग पढ़ते हैं? So health is on one hand a highly personal responsibility, and on the other hand a major public concern. It is thus it thus involves the joint effort of the whole social fabric, is it the individual, community, state to protect and promote health. Individual responsibility क्या, although health is now recognized as a fundamental human right, it is essentially an individual responsibility. It is not a commodity that one individual can bestow on another. No community or state program of health service can give health. In large measure, it is to be earned and maintained by the individual himself, who must accept a broad spectrum of responsibility known as self care. Now, self care in healthcare, presently, the trend in healthcare is self care. It is defined as health activities including promotion, maintenance, treatment, care, and health related decision making carried out by individual and families. It refers to those activity individual undertake in promoting their own health, preventing their own disease, limiting their own illness, and restoring their own health. These activities are undertaken without professional assistance, although individuals are informed by technical knowledge and skills. The generic attribute of self care is its non professional, non bureaucratic, non industrial character, its natural place in the social life. So, self-care activities comprises observance of simple rules of behavior relating in diet, sleep, exercise, weight, alcohol, smoking, and drugs. Now, others include attention to physical hygiene, cultivation of healthful habit and lifestyle, and submitting oneself to selective medical examination, screening, accepting immunization, carrying out specific disease preventive measures, reporting early when sick, and accepting treatment, undertaking measures for the prevention of the relapse and the spread of the disease to others. To these must be added family planning, which essentially is an individual responsibility. So, the shift in disease pattern from acute to chronic disease makes self care both a logical necessity and appropriate strategy. For example, a teaching patient self care by teaching patient self care, example recording one's own BP and blood sugar, the burden on the official health service would be considerably reduced. In other words, health must begin with the individual. इसके बाद हमारा कम्युनिटी रिस्पॉन्सिबिलिटी है, तो ये 2 मिनट में देखती हूँ. Okay, let's move ahead now. So, community responsibility. ये क्या है? Health can never be adequately protected by health services without the active understanding and involvement of the communities whose health is at stake. So, until quite recently, throughout the world, people were neglected as a health resource. They were merely looked upon as a source of pathology or victims of pathology, and consequently as a target for preventive and therapeutic services. This negative view of people's role in health has changed because of the realization that there are many things which the individual cannot do for himself except through united community effort. The individual and community responsibility are complementary, not antithetical. The current trend is to demedicalize health and involve the communities in a meaningful way. This implies a more active involvement in families and communities in health matters. Where is it? Planning, implementation, utilization, operational, and evaluation of the health services. In other words, the emphasis has shifted from healthcare for the people to healthcare by the people. The concept of primary health care centers around people's participation in their own activities. The Village Health Guides scheme in India, launched in 1977. The ASHA under National Health Mission are examples of community participation. Now, there are three ways in which a community can participate. The community can provide in the shape of facility, manpower, logistics, support, and possibility funds. It also means that the community can be actively involved in planning management and evaluation, and an equal planning and an important contribution that people can make is by joining in and using the health services. So, this is particularly true of preventive and protective measures. Further, no standard preventive and protective measures, sorry, further, no standard pattern of community participation can be recommended since there is a wide range of economic and social problem as well as political and cultural traits among and within the communities, which is essentially what is essential is flexibility of approach. However, community involvement is not easy to obtain, and extensive experience has indicated. The traditional Indian society is cut across on rigid religion caste lines. Appropriate role for each caste group have been serious obstacle in securing complete community participation. In the health sector, the greatest resistance is health guide improvement in primary health care come from medical professional that the lay public. Now, community participation have been an aphorism that is still waiting and genuine realization in many countries of the world. Long ago, Henry Sargist, the medical historian, stated that the people's health ought to be the concern of people themselves. They must struggle for it and plan for it. The war against disease is for health cannot be fought by physicians alone. It is a people's war in which the entire population must be mobilized permanently. listening? How many people are listening to it? So आगे देखते हैं. State responsibility क्या होता है? The responsibility for health does not end with the individual and community effort. In all civilized society, the state assumes responsibility for the health and welfare of its citizen. The Constitution of India provides the health is a state responsibility. The relevant portions are to be found in the directive principle of state policy, which are as below. So, the state shall, in particular, direct the policy towards securing that the health and strength of workers, men and women, and the tender age of children are not abused, and that citizens are not forced by economic necessity to enter avocations unsuited to their age or strength. That childhood and youth are protected against exploitations and against moral and maternal abandonment. The state shall, within the limit of its economic capacity and development, make effective provision for securing the right to work, to education, and to public assistance in case of unemployment, old age, sickness, disablement, and in other cases, undeserved want. The state shall make provision for securing just humane condition of work and maternal relief. The state shall regard the raise of the level of nutrition and standard of living of its people and improve on public health as among its primary duties. Constitution of India ऐसा कहता है part 4. Now India is a signatory to Alma Ata Declaration 1978 and the Millennium Development Goal 2000. The National Health Policy approved by Parliament in 1983 and later on in 2002 have resulted in a greater degree of state involvement in the management of health services. The establishment of national wide system of health services and emphasis on the primary health care approach. इंटरनेशनल रिस्पॉन्सिबिलिटी क्या होता है हेल्थ को लेकर के, तो वो देख लेते हैं आओ. So, the health of mankind requires the cooperation of government, people, nation, international organization, both within and outside the UN system in achieving our health goals. The cooperation covers such subjects as exchange of experts, provision of drugs and supplies, border meetings with regard to control of communicable disease, the TCDC, Technical Cooperation in Developing Countries, ASIN, Association of Southeastern Asian Nation, AARC, South Asia Association of Regional Cooperation are important regional mechanism for such cooperation. Now, eradication of smallpox and polio, the pursuit of health for all, Millennium Development Goals, Sustainable Development Goals, and the Goals Strategy for Women's, Children, and Adolescent Health, and the campaign against smoking AIDS are few recent examples of international responsibility to control for disease and promotion of health. Today, more than ever before, there is a wider international understanding on matters relating to the health and social injustice in the distribution of health services. The WHO is a major factor in fostering international cooperation in health. In keeping with its constitutional mandate, WHO acts as a directing and coordinating authority in the international health work. Now, health and development. Health and development क्या है? Lessons from Kerala state. देख लेते हैं हेल्थ एंड डेवलपमेंट क्या. हेल्थ इज एसेंशियल टू सोशियो इकोनॉमिक डेवलपमेंट. सो हेल्थ जो है ना सोशो इकोनॉमिक डेवलपमेंट के लिए ज़रूरी होता है हैज़ गेंड इंक्रीजिंग रिकॉग्निशन इट वाज कॉमनली थॉट इन 1960 दैट सोशो इकोनॉमिक प्रोग्रेस वाज नॉट एसेंशियल फॉर इम्प्रूविंग द हेल्थ स्टेटस ऑफ पीपल इन डेवलपिंग कंट्रीज now and that substantial and rapid progress could be made through introduction of modern public health and measures alone. According to this way of thinking, the role of human being in developing process was grossly underestimated. Now the period 1973 to 77 witnessed considerable rethinking on this subject. There was profound modification of the economic theory. It became increasingly clear that economic development alone cannot solve the major problems of poverty, hunger, malnourishment, and disease. In its place, non economic issues जैसे कि education, productive employment, housing, equity, freedom, and dignity, human welfare have emerged as major objective in development strategies. So the experience non economic issues आ गया है मेन डेवलपमेंट के लिए क्यों क्योंकि जो इकॉनमी था ना वो पोवर्टी हंगर ये सब को नहीं सॉल्व कर पा रहा था सो द एक्सपीरियंस ऑफ अ फ्यू डेवलपिंग कंट्रीज जैसे कि श्रीलंका कोस्टा राइका एंड स्टेट ऑफ केरला इन इंडिया illustrates dramatically the way in which health forms part of the development. It is because of the effort of the health field and simultaneously reinforced by development of other sectors such as education, social welfare, and land reforms. The link between health and development has been clearly established, and the one being the starting point for the other, and vice versa. So, since health is an integral part of the development, all sector of society have an effect on health. In other words, health services are no longer considered merely as a complex of solely medical measures, but a subsystem of the overall socio-economic system. In the final analysis, human health and well-being are the ultimate goal of development. Now, lesson from Kerala state क्या है कि Kerala is a southernmost state of India with a population of 3.56 crore and an estimated population density of 926 per square kilometer. The state of Kerala is extremely crowded. Its annual per capita income is 2,36,093 and was more than the national average. National average 1,28,000. Now, Kerala has surpassed all the Indian state in certain important measures of health and social development, as shown in this table. Now, death rate Kerala में 7 है, ऑल इंडिया में 6 है. रूरल बर्थ रेट जो है उसमें 13 है, ऑल इंडिया में 21 है. इन्फेंट मोर्टालिटी रेट जो है 6 है और ऑल इंडिया में 28 है. कितना कम कर दिया है बच्चे की मौत को. अंडर 5 अगर देखेंगे मोर्टालिटी तो 9 है और ऑल इंडिया में 35 है. मेटरनल मोर्टालिटी 3103 माई गॉड. एनुअल ग्रोथ रेट देखेंगे 0.62 है, 1.35 है. Life expectancy it's 75 here in Kerala and all India it's 69. Literacy rate जो है 96 है, all India में 77 है. Female literacy rate 98 है, all India में 71 है. Mean age at marriage of the female is 23 and all India में 22 है. ना पर कैपिटा इनकम अगर आप देखोगे तो बहुत ज़्यादा है ऑल इंडिया से. केरला हैज़ डेमोन्स्ट्रेटेड दैट इन अ डेमोक्रेटिक सिस्टम with a strong political commitment to equitable socio-economic development, high level of health can be achieved. Even a even a modest level of income. Kerala can therefore be considered as yardstick of judging health status in the country. Now, studies have shown that the effort in health field. So studies have shown that the. एक second, bro. Yes, I'm reading Park. Yes, a case. I know. We don't read Park. It's so weird to read Park, but it's good. I mean, why not? If I can do it, why not? Let's do it. So, Shashank, did you come back in the hostel? So, क्या बोल रहा है कि studies have shown that the effort in the health field were simultaneously reinforced by development in other sectors. Now, literacy जो होता है, either female literacy have played a key role in improving the health situation. This was probably responsible for high rate of utilization of health facilities. The long standing programs directed at social welfare raised not only educational level of the population but also developed a social infrastructure including transport network which provided easy accessibility to of the services. An effective program of land reform has given poor people access to land resources for food production at the household level. Now, Kerala has demonstrated that good health at low cost is attainable by poor countries but requires major political and social commitment. Now, health development क्या कहता है? So health development is defined as the process of continuous progressive improvement of the health status of a population. हेल्थ डेवलपमेंट क्या बोलता है? कंटिन्यूस प्रोग्रेसिव इम्प्रूवमेंट, मतलब हेल्थ स्टेटस एक पॉपुलेशन का इम्प्रूव करते रहना है, प्रोग्रेसिवली उसको इम्प्रूव करते रहना है. दैट्स नोन एज हेल्थ डेवलपमेंट. it its product is raising human level. uh, its product is rising level of human well-being, marked not only by reduction in the burden of disease but also by the attainment of positive physical and mental health related to satisfactory economic functioning and social integration. So the concept of health development. Hi, hey Shan, did you come? Are you in the hostel or what? So what happens is that the concept of health development as distinct from the provision of medical care is a product of recent policy thinking. It is based on fundamental principle that governments have a responsibility for health of their people, and at the same time people should have the right as well as the duty individually and collectively to participate in the development of their own health. Now, health development contributes to and results from social and economic development. Therefore, health development have been given increasingly emphasis in the policies and programs of the UN systems. One example is that World Bank, which is providing fund for health component of economic development program. The UNDP has also shown a growing interest in health development, as has the World Bank. So indicators of health, क्या क्या indicators है health का? This is a very important question. Indicators of health, ये आ भी जाता है. Now first indicators is mortality indicator, then second is morbidity, then third is disability rate, fourth one is nutritional status indicator, health care delivery indicator, utilization rate, indicator of social and mental health. Now environmental indicators, socio-economic indicators, health policy indicators, indicators of quality of life, social indicators, basic need indicators. 13 indicators है basically health का. So we'll read after some time. I'm ending the live session, and when we again come, then we'll read this. Okay, thank you.